Question 1. Which of the following skills makes an auditor stand out? A. Strong communication. B. Research. C. Time management. D. All of the above. Question 2. True or false? Starting January 1, 2026, skin substitute products not in sheet form will be paid as incident to supplies. A. True. B. False. Question 3. A 65-year-old male with an implanted spinal cord stimulator requests removal of his neurostimulator pulse generator because of its waning benefit. The subcutaneous neurostimulator pulse generator is disconnected and removed from the electrode array. How is this coded? A. 63688. B. 64595. C. 64598. D. 0785T. Question 4. A patient starts care at your practice at 28 weeks gestation and receives 8 antepartum visits, delivers with your provider, and has a postpartum visit. How is this coded? A. 59400. B. 59426, 59410. C. 59426. D. M codes for each antepartum visit plus 59409 plus 59430. Question 5. Which of the following is a myth that undermines healthcare treatment for addiction? A. Early intervention leads to better outcomes. B. Substance use disorders cause changes in brain function. C. Medications for opioid use disorder cut overdose risk. D. Abstinence-only approaches are the gold standard. Question 6. A 52-year-old male patient with a known history of debilitating right-sided sacroiliac pain, localized to the right buttock and posterior superior iliac spine, has implantation of triangular titanium implants across the ilium, into the sacrum, crossing the joint space. How is this coded? A. 27278. B. 27279. C. 27299. D. None of the above. Question 7. A 74-year-old male, who is on anticoagulation with a pacemaker, presents with elevated prostate-specific antigen and suspected prostate cancer. A 3 Tesla prostate MRI or a 1.5 Tesla prostate MRI with an endorectal coil is considered as an alternative to standard prostate biopsy. Mr. Safety Assessment demonstrates a pacemaker that is not a complete Mr. Conditional pacemaker system, lacking Mr. Conditional labeling and programming modes. How is the Mr. Safety Planning Service coded? A. 76014. B. 76016. C. 76017. D. 76019. Question 8. According to the U.S. Surgeon General, which of the following best describes burnout? A. A mental illness characterized primarily by clinical depression. B. An occupational syndrome marked by emotional exhaustion, cynicism, and low sense of accomplishment. C. A short-term stress reaction to increased workload. D. A diagnosis that must be treated with medication. Question 9. A patient receives 5 antepartum visits but transfers out of your practice before delivery. What is the most appropriate way to bill for the antepartum care provided? A. 59,400. B. Each visit with appropriate E/M codes, 99202, 99205, or 99212, 99215. C. 59425. D. 59426. Question 13. A physician conducts a phone call with an established patient as an E/M service with moderate MDM. The call lasts 22 minutes, 15 of which were dedicated to medical discussion. Per CPT guidelines, how is this coded? A. 98001. B. 98013. C. 98014. D. 98016. Question 14. How many elements are there to the OIG's compliance program infrastructure? A. 5. B. 7. C. 10. D. 12. Question 15. Which of the following is an early warning sign of burnout? A. Strong motivation to mentor coworkers. B. Responding to high demands with perfectionism and urgency. C. Increased participation in wellness programs. D. Taking a long vacation. Question 16. A 38-year-old patient with sacroiliac pain, evidenced by radiation to the left groin and posterior thigh, has tried medication and physical therapy with no relief, so he receives an intra-articular cage system. How is this coded? A. 27,278. B. 27,279. C. 27,299. D. 29,999. Question 17. Which is not one of the OIG's elements of an effective compliance program? A. Transparency. B. Compliance leadership and oversight. C. Risk assessment, auditing, and monitoring. D. Training and education. Question 18. When documenting psychotherapy time, which of the following is best practice? A. Automate notes to format a uniform time for every session. B. Avoid vague time estimates. C. Include charting time as part of the psychotherapy time. D. Document total time only, never start and end times. Question 19. The surgeon makes an upper midline incision in the abdomen, dissects down to the pancreas, inspects the upper abdomen, and identifies the area of disease. The distal pancreas is freed from its attachments and the surgeon cuts away the diseased tissue and removes the spleen. The obstructed part of the pancreatic duct is removed and a new connection between the jejunum of the intestines and the pancreas is made for drainage of pancreatic enzymes, ensuring hemostasis. The surgeon closes the abdominal wound in layers. How is this coded? A. 48,140. B. 48,145. C. 48,146. D. 48,150. Question 20. A 12-year-old boy presents to his primary care physician with a fishhook lodged in his right hand. What is the ICD-10 encounter code? A. W44. E0BS 61.441 CW 45.3 XXAD W 45.8 XXA.